It's a very complex piece of business, healthcare. Certainly, Tommy Douglas was a key actor. He very strongly believed in a publicly funded single-payer healthcare system on the principle that accessibility to top-notch quality healthcare was a basic human right, not dependent upon capacity to pay. But there's another dimension to this, and that is that because of the Depression in the 1930s and even before that time, Saskatchewan has had a tradition of acting in a cooperative way. It was about the only way you could overcome the forces of nature and the lack of money and a small province with difficult financial circumstances during drought periods. So it was a little bit easier for him to sell it. So it's a combination of ideology and philosophy principled by Douglas, and the ground being more fertile for his views to take seed and sprout. If we have a philosophy that we're all human beings of different gender and different age and different ethnic background, do we simply say at a time when a person is probably most in need, that's your business. You take care of it yourself if you've got the money. I'll worry about it in my own business. Or do we say as a society we come together, pool our resources, and try to make sure that as a fundamental right of people there is access to health care? Well, I subscribe to the latter point of view. I'd come from a big L liberal family. My parents were new immigrants from Ukraine in the mid-1920s, and so they were fleeing from communism and anything that even resembled it. They didn't like that. They didn't like the CCF NDP very much. But by that time I was on campus at the University of Saskatchewan, and I was a student president, and it came at the time of the 1962 battle over entrenchment of Medicare. The doctors went on strike, and the province was just bitterly divided. So there was no room. You either were for Medicare as Douglas was implementing it, the single-payer public system, or you were against it. I was very much taken by the charisma of Douglas, and his oratorical skills were really second to none. But more importantly, the idea was really the thing that attracted me to it. And so that's essentially how it all got started. I knew Tommy relatively well. He actually spent a month in China with him in 1979. So I got a month of lectures on Medicare and on hospitalization and everything else. So I'm a fan of Medicare. To me, it's that we must root ourselves in the belief that healthcare is a fundamental for every woman and man, young or old, of every background, doesn't matter. We care for each other in our time of greatest need. A defining feature of what I think it means to be Canadian.